time for change.
Change, change,
Change, change.
change begins now.
Keir Starmer speaking when he won the election. 5 months after saying change begins now, he unveiled his plan for change.
Today we publish new milestones, measurable milestones, that will also give the British people the power to hold our feet to the fire.
Some earlier promises have been watered down. Some, like the plan to build 1.5 million homes and cut hospital waiting times, have remained.
Some people may say, that's pretty brave. You've seen the books now. You know how hard that NHS milestone is. Building 1.5 million homes is ambitious, perhaps a little too ambitious. And look, I'll be honest, they're right. We face an almighty challenge to hit these milestones by the end of this Parliament.
Speaking in Pinewood Studios, home of the action movie, the Prime Minister signalled what sounded like a newfound frustration with the Whitehall machine.
I do think that too many people in Whitehall are comfortable in the tepid bath of managed decline. Thank you very much.
Instead of the original election promise of world-beating economic growth, the government now promises to grow household income, currently forecast to creep up by only 0.5% each year.
Do you give yourself a pass mark if it is 0.5%? Is that job done?
Nobody feels they're better off under the last government. And, you know, we just tested that on the 4th of July across the entire country. One of the main conversations on every doorstep was people saying they didn't feel better off. In fact, they felt worse off. That's what we are intending to change, and that's why we've made it one of the priorities under the plan.
I think we wouldn't really call it an almighty challenge. In terms of growing living standards, what the government has set out is really just the bare minimum. We've seen over all parliaments since 1955, every single one has seen real disposable income for households grow by some amount.
One measurable milestone commits to reducing the number of children who turn up to start primary school without being ready to learn.
4 and 1, well done.
So they haven't learnt the basic skills of social sharing, for example. We're seeing issues around bathroom training, for example, so more children arriving in a school setting in nappies. And it's just that overall they're coming into the school setting and the staff in the reception classes are having to do so much work to catch them up with their chronological age.
Included in the new milestones, the old promise to put thousands more policemen on the beat. Some experts say it panders to public misconceptions about what works best.
I think this is just really incredibly important, that sense of security in your own town centre.
So it is focus group led more than anything else, this type of policy.
If I walk around my town, my constituency, this is the issue that matters so much to people.
This is a government that's come in with a mandate for change. We are delivering on that change. We've only been in for 5 minutes, but a lot done and a hell of a lot more to do.
You've been in for 5 months. It might feel like 5 minutes, and that's why people are a bit baffled that we're only now getting the plan for change.
Every single one of our missions, on every single one of the milestones that we set out in the plan for change, the work has already begun, but it's important that we set out the tests for the voters that they can judge us on, and that's what we've done today.
Keir Starmer wants public sector reform to drive efficiency and make his change plan affordable without more tax hikes. But some feel that work is dangerously behind schedule.
There isn't much of a coherent framework that we can see for the vision for how departments should be operating differently to deliver better outcomes. I think there's a lot of details still to be filled in, some of which perhaps might have helpfully been done in opposition, but now time is against them.
Some people think you're a bit frustrated with the pace of public sector reform. Some of the departments aren't coming out with it fast enough, making enough savings.
If you ask me, do I want to go further and faster on growth, on improving our health service, in getting more police on streets? Of course I want to go further, and we need reform to deliver all of those things.
Keir Starmer knew he would be mocked for rewriting his priorities yet again, but hopes he can live that down and pick up the pace of government action.
It's hard not to be puzzled by all of this. We've moved from missions, first steps, milestones, pillars. We even briefly on one foreign trip with Keir Starmer had the whole thing reduced to 2 priorities, growth and migration, which don't exactly dominate this document today, though he says they underpin everything. There's confusion as well about Keir Starmer suddenly lashing out at Whitehall in this speech. One senior Whitehall figure said it all sounded a bit Trumpian, Farage-like. It's been noted everywhere. This sort of snapping at the civil service suggests that there is enormous frustration inside government. But Keir Starmer himself, of course, served in the civil service at the very highest level, at permanent secretary level, when he was Director of Public Prosecutions. Most people thought he was very sympathetic to the institution. There's confusion as well, of course, about the sequencing, because here you're getting measurable pledges, effectively. 5 months after a general election, you get your pledges in a general election. What all this really shows is that this is a government. They don't want you to use the word. They don't want anybody to be having this word in their head. But this government is effectively doing a bit of a relaunch here. And you shouldn't be doing that 5 months in. It suggests they themselves think they haven't done that well. And this, I guess, is how they intend to do better.
Gary, thanks very much. So when it comes to the NHS, the government has today pledged to meet the long-standing target of getting patients from GP referral to treatment in no more than 18 weeks for at least 92% of non-urgent cases in England. But the latest weekly figures show NHS England under pressure already, with hospital admissions for flu up 350% on the same week last year. Our health and social care editor Victoria MacDonald reports.
That the NHS needs emergency care is not disputed, but today the question was, in which direction?
The 18-week target from referral to treatment finally met. A symbol of the NHS back on its feet, facing the future, dignity and care restored to millions.
The waiting lists in England stand at more than 7.5 million. Meeting the 92% 18-week referral target by 2029 is ambitious. But a powerful case for getting the lists down is made by patients like James Wilkinson. His heart operation was postponed 5 times before he went private.
The last 3 times I went in a Sunday evening, had my chest shaved, all gowned up, ready for the day after. And then every day they came in and said, "Sorry, Mr. Wilkinson, it's not happening today."
And did they tell you why they were cancelling?
Not enough beds, predominantly.
Not enough beds?
Yeah.
Yesterday, the British Heart Foundation handed a petition to Downing Street, urging them to address the worst heart care crisis in living memory.
We need to get that backlog down. With 420,000 people on it right now, we're really seeing people suffering of disability and sadly losing their lives way too early. So we must get back on track.
The PM explicitly said recovery of non-urgent elective care did not give the NHS permission to allow everything else to suffer, yet that is the fear.
Well, it's interesting. There's no mention of the other targets today on the basis that none of the government's or the health system's targets have been met for many years. There is a real question about how many can you meet in a single parliament and how wise is it to try to meet them all. So I think what we're seeing today is definitely an elevation of the 18-week target. That's where money has been set aside and focus is going to be given, that other things will fall by the wayside as a consequence of that decision.
NHS England published its winter figures today, showing an increase in ambulance call-outs and nearly 12,000 patients ready to be discharged but stuck in hospital for lack of community care. Today's figures from NHS England show just what intense pressure the health service is already under. Flu figures, for instance, are 5 times higher than they were this time last year. There's COVID and norovirus. And yes, the government does have to tackle the elective waiting lists, but they have the immediate problem of the patients who daily keep arriving in hospitals across the country. No mention by the Prime Minister today, too, of GP appointments or mental health services. Or here's another example, inflammatory bowel disease, which would largely not be included in the elective care target.
At the moment, someone's referred in with, say, a hernia, which is not a very nice problem to have. They will be referred in by their GP to the hospital, usually, their general practitioner, their family doctor, and they will instantly start a clock. This 18-week target will apply to them. When it's an internal referral for these IBD patients, this clock does not start at the moment for most of these patients. And therefore, not only are we potentially disadvantaging them, there is no incentive to drive their care forward.
A&E waiting times and ambulance handovers are also targets, and while the government will blame the Conservatives for those queues this winter, inevitably they will face questions if no recovery is detected.
Well, earlier I spoke to the Work and Pensions Secretary Liz Kendall, and I began by asking her why Labour had watered down promises they made on growth and clean energy during the election campaign, and if governing was harder than they'd expected.
That has not been watered down. Our absolute ambition to be the fastest growing economy in the G7 is in the document.
It's an ambition, not a promise.
It is not a downgrading on clean homegrown energy. 95% or above is absolutely what that would be. But is being in government hard? Yeah.
And is it harder than you
absolutely
expected?
is.
I mean, did you not have a plan as worked up as you perhaps should have done?
We did. I tell you what has been really hard is trying to deal with the financial mess. That has been really tough. But you know, if you come in to run any business or any organisation and you're spending more than you earn, you can't make big changes unless you sort that out. And that was the first step. And this is now showing what people will be able to judge us on.
Should they vote you out if you don't meet these
If we don't
pledges?
deliver, they will have every opportunity to vote us out.
Right, so let's talk a little bit more about the economy, because that pledge on disposable income rising, what does that actually mean?
That people will have rising living standards. But it is also not just real household disposable income, but the second part of that, clearly in the document, is rising GDP per capita in every region as well as nationally. We can overcomplicate politics, but people have got to feel better off.
How big a pledge is that, really, when disposable income rose during the last Parliament, when there was war and there was COVID? I mean, if you can't get it to rise this time, it would be pretty pathetic.
If you spoke to any of my constituents or people across the country and said, rising living standards, you feeling better off, would that be a big change? They would say yes.
Let's talk about health, because that's a big part of these missions.
It'll be a key issue on which we're judged, I've no doubt.
So where is the mission, the milestone, the pillar, call it what you like, on social care? Because there wasn't a single word of that in the Prime Minister's speech today, and that's one of the biggest challenges that we all face.
It really is, and the truth is you won't get waiting lists coming down unless you tackle the problems in social care, because we've got too many people ending up in hospital because they can't get the care they need at home. I am under no illusions that we need more money in the system, and we have put £22 billion extra into the NHS, but you also need reform.
But you keep saying you need reform, but there's no details. All of those big decisions on social care and welfare kicked into the long grass.
Definitely not on welfare. We've set out the biggest reforms to employment support in a generation, overhauling our job centres, a youth guarantee. But let me come back to your question about social care and the NHS. And you will see in the 10-year plan on the NHS a big focus on shifting from hospitals into the community, preventing people from getting ill in the first place, joining up that support locally so you don't have to end up going in hospital. The measure out there is about waiting lists, because that's what most people care about. But in order to deliver it, you've got to have much wider reform in the rest of the system.
How useful are targets? There's a warning from senior people within the NHS that that's going to have a knock-on effect and damage operations in A&E and other vital services.
Targets are important to galvanise action, to galvanise the whole system of government to focus on what matters. You know,
so why not in immigration then? I mean, you're sort of saying targets in one. Is it because you think you won't make them
because
on immigration?
Look, the Tories picked targets, you know, plucked them out of thin air, and that didn't work. They did it for a headline-grabbing exercise.
And this isn't that for NHS?
No, it isn't. For the NHS, there is a clear requirement in the NHS constitution for 92% of patients to be seen within 18 weeks. I think that is a really galvanising point.
Right, so why not galvanise things on immigration as well?
We've been very, very clear that we've got to get net migration down. We've said how we're going. We've got an absolutely clear plan, sorting that out with setting up Border Security Command, having more offices in the National Crime Agency, having more returns, 9,600, I think, 30% more than were under the Tories.
The two-child benefit cap has been axed by the Scottish Government. Will you enable them to implement that policy, or are you going to block it because they need your cooperation to do it?
We will work constructively with them,
because we believe in devolution to give them all the data that they want. I don't think they've set aside a single penny from the £4.9 billion that was given to Scotland in the biggest ever devolution settlement in the budget, but we will of course work constructively with them, and we are taking forward our own bold cross-government strategy to tackle child poverty.
Liz Kendall, thanks very much.
Pleasure.